this session on a Friday instead of a Saturday because of Dr. Dinesh's availability. But I'm so glad all of you are here. And before we get started, I thought I'll take a couple of minutes to kind of go through some basic hygiene factors and other things that are ongoing at Musings. So I will go ahead and share my screen. So just letting you know about a few things that is currently ongoing and upcoming at Musings. So all of you know about the plant module that that's ongoing for from the last 5-6 months. It has been a wonderful journey studying the plants in depth through the various aspects that are there. Including the sensation, including the evolution, including inner age and personal evolution method, provings, and lots of cases. We are just going to be starting subclass. We are going to we have started subclass 5. We're going to be continuing subclass 5 in August, and we are going to end this 1 year module with a retreat which is planned in Pune for 3 days. So we will invite you very very warmly to this retreat. We are going to be studying monocotyledons in this beautiful farm overlooking the lake. But along with studying monocotyledons and homeopathy, we are going to kind of add in a lot of therapeutic healing therapies, which will help us heal as healers, but also something that you can learn and then use it back in your practices. We'll be very close to nature. We'll be having plant-based, wholesome, organic food. It's going to be excellent. So I warmly invite all of you to try and make it to this retreat. We have Milk Matters. Patricia is coming in September. She's going to take a 4-day module. It's a 4-week module about milk matters, about human milk, about lactation issues, about the role of homeopathy in lactation, the role of lac remedies, especially lac maternum and lac humanum, and how to differentiate that in this very, very clinical module. So again, see if you would like to join us there. And then there is defense mechanism by Dr. Ajit Kulkarni. This is something that's going to come up in October. And again, this is, I think, a 6-day session. It's going to run through 6 weeks. And this is again a very novel concept, something that he's going to be taking in India for Indian audience for the first time. So again, invite you to join us there. We just kicked off this week the mineral journey, row 3 and row 4. Last year, as you remember, we did the row 1 and row 2 with Dr. Shekhar. He is our beloved friend, mentor, teacher, everything. And we just kicked off this Wednesday, the row 3s and row 4. So if you'll have not registered for this already, again, do try and join us for this excellent course. So with that, what are we going to be doing today? We're going to be hearing and learning and getting inspired from this excellent teacher, a name that is so familiar to all of us, Dr. Dinesh. Child-centric homeopathic case witnessing processes, and he's going to be talking about verbal as well as non-verbal group. I am going to fall short of words. I don't know how to introduce
Hello.
Okay, it seems I got kicked out of the meeting. out of the meeting due to the internet issue, but I hope you were able to hear me so far. So I was just saying that I'm going to be falling short of words if I have to introduce Dr. Dinesh. He has been our inspiration for me and Prajakta both. Uh, and I can also reveal a secret. He is such a dapper looking man, So I'm sure a lot of women in homeopathic world are going to agree that way also. But for me personally, if I have to say this, to name case taking, to revolutionize it and call it case witnessing, it changes the whole perspective altogether. Uh, to say that I'm going to take a case versus I'm going to witness a case, I think that just changes everything. It changes perspective, it changes our relationship in that space, that sacred space that we build with our patients. So without further ado, I want to call sir on stage, and I want to make use of these entire 2 hours that we're going to have with him. Before I do that, just basic hygiene factors. Please mute your lines. Keep your videos on if possible. You can interact with Sir. He will get to know you as well. If you have any questions, please put it down on the chat because we're going to be a lot of people. It's going to be very difficult for all of you to unmute your lines and come in. So maybe put it on the chat box, and at the end of the session, maybe we can take your questions. A lot of times on Zoom, people end up scribbling on the screen. Please don't do that. It's very, very disturbing for the speakers. And make notes of all the important points that you hear. We will have the recording of this session. We will also have the recording on the YouTube. A lot of people will be joining us live on YouTube, so that is also possible. So don't worry if you miss something out or your internet is not stable, etc. You will have the recording for it to go back to. And I think lastly, just sit back and enjoy the session. With that, sir, if you're here, I
Yes,
invite you.
I'm with you. I'm with you. Go ahead.
Perfect. So over to you, sir. Thank you once again for taking our invitation, for making the time. And where you are sitting right now, that looks like such a nice, beautiful, and already a healing space. So I think the
Mm.
energy is already passing through. So over to you, sir.
Thank you, dear. Thank you, Preeti and Prajakta. So let's start directly. Yeah. So go ahead. If you know the topic, it's centered around child-centric case witnessing process. Any question, any one of you, just feel free to put there. We invest 5 or 7 minutes in questions and then we go ahead. Meanwhile, I'll just share my screen till you are check. Where is your lecture?
So you want me to take up some questions that come up on the chat?
Yes, go ahead.
Okay, so I think there are a couple of questions. One is related to, when children are not responding to questions. So, how important drawing is, and how do you use it? And then another question is regarding how do you explore dreams in children? So dreams and drawing.
So that's a good question because children lives at the, especially up to 10, they live at the imagination level, where their fear, phobias, dreams, artwork, they speak through that. So The best is, how to explore those areas. And one of them is, as you're asking, dream. Very good. I'll talk about it. What else? Any other question is there?
So the second was related to
Too far,
drawing.
I think.
When
Uh-huh.
child is not responding to questions, um, how to handle? I mean, can we use drawing as a modality? Like ask the child to
Drawing
draw.
as a
That's
modality. Perfect.
yeah.
That's also a good question. Among this group, how many of you have attended my lecture?
Hmm. So maybe we can.
So accordingly, I select cases.
Hmm.
Anyway,
I think it should be 50-50, sir. 50%
perfect.
may have attended, and some will be freshers or new homeopaths who may not have got the opportunity yet.
Perfect.
There are a couple of other questions that are coming in. One is by Dr. Rhea. She's saying how to handle a child case who is not willing to talk. Um, then there is another question by Dr.
Naturally, there are two
Hmm,
groups of children where one who
hmm,
can talk but does not want to talk. Like
correct.
especially, teenagers, they've been forced in the cabin by parents or people around and they don't want to talk. And there are some children which are non-verbal group, especially they're grown up but non-verbal, like autistic spectrum and the what we call uniquely able children, whether it is cerebral palsy or ADHD and all those children. So what to do with them? That's a good question. Then
So I think there was a follow-up question by another homeopath, and it is that in differently abled children, how is the case taking different, and how do we kind of modify it for differently abled children? And another one that just came in by Dr. Paras, he's asking, sometimes children do some specific action, there's some repetitive actions, how to interpret them?
yeah, so sometime as you said, some system pay a lot of attention to the body language,
Hmm.
and you see that the sometimes some gestures keep coming again and again. Yeah, so what to do with it? Good. How to interpret and not.
Yeah.
Okay.
There's another one by Dr. Jyoti. She's asking, how do you do a case taking for children who are adopted? So you will not have mother's history during pregnancy, for example.
So that's good. So that the most important part, what we all base our practice, especially children who cannot speak, is mother's history during pregnancy. And then once that's not there, yeah, can be dangerous. They're not talking, so that's also out. And plus this, what to do? Hmm? Good.
Yeah. I think more or less that's it so far, sir.
Perfect. So let's start. I'll do my best in how much time we have? 1 hour, 2 hour.
Well, we can be here if you're talking the whole day, but it's it's upon you how much time you have, sir. We're
No,
scheduled from
you're what we call official time.
we are here till we block 2 to 4 for people until
2
4
to
p.m.
4. Let's
Yeah.
start. Yeah. So first let's start with this. Since it's the children lecture, let's start with nursery rhyme. Maybe this is our prayer to start. And the nursery rhyme is Humpty Dumpty sat on a wall. Humpty Dumpty had a great fall. All the king's horses and all the king's men cannot put Humpty Dumpty together again. So we know this, it's fallen and the pieces are all around. What I personally feel is the problem of Humpty Dumpty and problem of homeopath, it's very similar. Now imagine that all the king's horses, like all the different homeopathic approaches, and all the king's men imagine different homeopaths using, their own method or a books, their centric, book centric approach. In spite of that, they are not able to put Humpty Dumpty together, means imagine, make him a whole again. Now, there are a lot of problems. You see, one of the problem is this. If you see in the picture,
So we just see a folder. We don't see.
okay. Wait a
Yeah,
minute, Peter. So that means I've not shared still. I thought it's. Is this good enough now?
we see the Humpty Dumpty. Now it's
Very
gone again.
now.
Yes, we can now.
Okay. So one of the problem is this. If you see, there is some issue here. Yeah, that they put all the parts of Humpty Dumpty together again. There's something missing, here. Everything is there. All parts are there. And this is when, when we do like mechanical repertorization or mechanical collection of the symptom and just give the medicine, or repertorization mechanical, where we take the part general, mental or physical, but we miss the whole essence. Or there are some people like this, yeah, where they do beautiful methods. Where they give advice, but the advice is not patient centric or holistic centric, but the book centric advices. The homeopathic counseling is not about case taking, or a counseling is not about patient centric, but the book centric. Or if you look at this way, once like this, he was past his sell date anyway. Once your centric, your book centric, one method, one person, one book, one system oriented approach which you're mastered, once it fails, then you start blaming the situation or the patient and not the system. This is generally happens with all of us when we are stuck with one approach. Boger, Boninghaus, full stop. Boric approach, full stop. Kantian approach, full stop. Sensation approach, full stop. Genetic constitutional approach, full stop. PPP, present predominant persistent symptom, full stop. Now that is where, problem. So what is required is that we all have what we call two-dimensional, which is one person, one system, one book, one method oriented approach. Either you say, I'm Hahnemannian, Boninghaus, Kantian, Mr. Vitolka's approach, or sensation approach, or genetic approach. Or, of course, when I'm teaching, I'm in the middle because I'm better than everybody else. So my approach. What we need to do is move from this two-dimensional fixed approach to what is called, inclusive, integrative. The word which I would like to use here is multi-dimensional holistic approach. Yeah, whether in case taking, which we will focus here on the children case taking, or whether reading your remedy, or whether selecting a remedy, or follow-up criteria, or posology, or in that any aspect of your life. See, what are we doing? We talk about individualization and we say, yes, take individualistic aspect, physical particular, physical general, and we say mental general. We take it. Or we add with this pathology, yeah, or we add with this miasm, or we add with this diathesis, constitution, or sphere of action. Right? We all do. But we talk about three cardinal principles. We directly take this route to similimum, 95% of us. But what about this? Since 250 plus years, we are talking about it. But tell me, how many of us use holism in case taking, in remedy selection, in posology, in follow-up criteria, and every aspect of homeopathy? We don't do it. That's why the first principle before I go to children, that what is important thing is individualization at a whole level. That is the cardinal principle. And based on that, when you reach to the similimum, it is more classical, more Hahnemannian, or more classical homeopathy than any other approach. Do you agree with me? So that's the first thing. So how will you find the holistic symptom? Yeah. Imagine among the scattered particular general and mental general, there must be some symptom where mind and body connect. There must be some symptom where physical particular and physical general connect. Some symptom where, physical particular or general by mental general connect. Or in some where the general and particular not coming, but the different aspect of the mind. Fear, dreams, delusion, all those things, they come together. Yeah. So that symptom where mind, body, general, particular, mental, general, different aspect of mental come together is holistic symptom. Different master calls it by different name. Hahnemannian calls it holistic. PQRS at holistic level. Boningos people call it grand generalization. Boger students calls it synergy or genius. Vitolka's student calls it the essence. Dr. Rajan students calls it sensation. And like that, I can go on and on from every school, from AA school to every. But what I'm trying to say that is that holistic symptom which different people give different name, but they are practicing there, we are missing. Yeah. So the first, what I'm trying to say that when you do anything in homeopathy, find out individualistic aspect at a whole level, along with general, particular, mental, general, and all other things what you are doing. And when I combine that together, that is where what I say is the integrative, holistic approach. Imagine you are reading a remedy or reading a patient. Then initially you will get random some particular symptom, some general symptom, some mental symptom. But there must be some symptom where particular and general and a mind, what we spoke, come together. That is holistic. Once you get hold of that, either in reading materia medica or case taking, go to the next step. Yeah, that holistic symptom I call master key, which I told you different master calls it different name. Is this clear? Once I get hold of master key, with help of that master key, because I know this is the holistic symptom or a key, if you pursue it further or explore, all this scattered thing can be understood in a beautiful system. Yes. Now that system is different in different patient. Why I say this? Look at here, come to here. So in some patient you get holistic symptom, PQRS at holistic symptom, and you get physical, mental general, physical general, and physical particular. In some, you get it whole plus miasm. In some, you get it whole plus pathology, diathesis, constitutional, and that. In some, you get it whole plus the themes or the language of the substance. In subnaturum, you directly go to the source language. Are you there? Why I'm saying all this thing? Said, depending upon what is the system of that patient, use that tool to find simillimum of him. For example, PQRS at a whole level, and you have put this scattered general and particular and mental symptom. Naturally, my first approach would be repertory or materia medica. Start from there. If it is whole plus the disease or diathesis or proneness, then I'll select those books where this is mentioned nicely. But if the language is of whole is with themes, then I'll not start repertory first. I'll start with kingdom, sub-kingdom, and the source. Clear? So this is what I'm trying to tell, that this way you can use your all classical tool of materia medica repertory. Then in materia medica also Kantian type, Boger-Bonninghausen type, keynote type, the modern master type, proving type, like that. Is it making sense? That way, and you can use thematic book and the modern masters like Mr. Vitolka's Materia Medica Viva to Massimo to Dr. Shankran to Sholton to all those who are speaking about the themes. That way it is easy. Then it is not, this approach as far as I see is not one book centric, one person or one system centric. You actually come to integrative approach. This is clear, and you can look from different aspect. Once this is clear, now I'll cut short the joke. We come to the case taking part. Yeah. Now, naturally, in a case taking part, I need those steps which are simple, scientific, reproducible. The whole aim of those not only to get scattered PQRS at particular general, mental general, but also to get at a whole level. Is it clear? So this is what I was searching around 2003-4 after I wrote a book for Dr. Shankaran and Insight into Plant. I thought this is my journey, and that's where I went. So I was looking for those steps of case taking, like Hahnemann mentioned in 83, 84, 85 too, around 103. There's those steps where you initially put open-ended scientific effort, where initially the end result can be scattered, not connected, like PQRS. Yeah. Amongst them, once you see a master key, then you start a second step where the things, and if it is right, things start getting connected together, this scattered symptom. And once they start getting connected, you know you are on a right track. You don't look here or there, and you go for a kill in a way that you get hold of that master key, which you are convinced now. Keep asking till everything gets connected in a beautiful whole, which we spoke just a slide with. It's like this. If you see this cartoon picture, let's say you ask about a chief complaint. Patient start with a chief complaint and he gives this 2 PQRS. Then he goes to generals and he gives this 2 PQRS. Then he goes to, let's say, fears and he gives you this 2 PQRS. Then he goes to dreams and let's say he gives this 2 PQRS. Most of us, 95% of us, start thinking of the remedy, our tool repertoire or whatever at this stage. But this would be disaster because these are scattered data. Every one of us will interpret in our own way. Making sense? So the best is, in a first step, check what is that which came up in particular, general or mind also, at least in 2 areas. So I see this circle, which I don't know what it means. And I don't want to interpret at this moment of time. I don't want to convert into a rubric language or a material language. I just ask what it is. That's my step 2. And once I start asking the other things, they start coming together. Then I know I'm on a right track. And once I know I'm on a right track, I start the step 3, where I ask about this, where I'm now convinced this is the center or a master key or a holistic key. And keep asking. And there I see all they come together. Sorry. All come together. At this stage, let's say we are 70 of us here. We will say this is a rat or a mouse. But the same rat was present here. I'm convinced 90% of us would interpret in our own way. This is, so I wanted system like this. Of course, I've spent 4-5 years. And after that, the system, what I understood of a case taking, the 3 steps of case witnessing, which I put in my book called A Scientifically Intuitive Case Witnessing Process, the Journey of 3 Steps. What this 3 step I put, now be with me. First with the grown-up, and then we come to the children. Initially, like Hahnemann mentioned in 84-85, the first step is the passive case taking, open-ended. Yeah, and you ask open-ended question and let them go where they want to. I'll tell you what I do with children. And they can start from particular, general, mind, dreams, childhood, doesn't matter. Once they stop or they can't go further, I guide them, but open-ended again, in different stages of their life, different situations of their life. Different stages means childhood, teenage, before menses, after menses, like that, before marriage, after marriage, and just to check in different stages what are the PQRS are running. Then different situation, they in their personal life, they in their professional life. Then in their subconscious, like fear, dreams, interest, hobbies, childhood, etc. Finally, illness with their exact location, sensation, modality, and concomitant. You see, now I have 8 different areas. I'm sure 3 or more than 3 areas of this will speak about some symptom which are constant. They will become the master key or holistic key. Once that comes, I start my second step, that is active with master key many times. And many times, if I don't have, then all the PQRS in this area, one by one, I explore. As Hahnemann said, I think in 85 or 86, once you get enough, explore each one, especially when you don't have the holistic key. So active. And then once I'm confirmed, as I showed you in that cartoon, I go to the third part, active. And there where the whole pattern or whole system is either PQRS with other PQRS, or with miasm, or with illness, or with kingdom, subkingdom, or the themes. And then based on that, you start the next step. And this worked very well for me, especially children with cases with any age, any illness. When people started questioning about children, that what you will do with children, because they generally don't talk about different stages, different situations, illness, they don't care when they sit in front of you. Then again, you are dependent on parents, but they have their own interpretation. No? So that's where my second step started, is child-centric case taking, which I wrote in my book called A Wonder with a Little Wonder, Child-Centric Case Witnessing Process. Of course, before that, I had already gone through the similar steps in non-verbal children, deep irreversible pathology, in psychiatric cases, in old age, in people with all defenses, organ transplant, cancer cases, children with people with low level of experience, like that. Anyway, so that's after doing all, then the children one, which I had actually started my journey with children. So then the first book was about children who can speak. I divide children into children who can speak and children who cannot speak. Then the other, children with acute and children with deep pathology. Yeah. Then the children who can speak, they are divided into 2. The imaginary age up to 1 to 10, 3 to 10 where they can speak, and teenager, yeah, from 13 to 16 or whatever the age which we put children age. Your questions had to be little different. Non-verbal, we go further. So then it's all about that how do we do case taking in children? Yeah, and what are the different steps? So the open space of passive, according to the children, verbal children, age, whether imaginary or teenage, your question differ. For example, a child at age 5, 6, 7 comes. My first question would to them would be, can you tell me about you as if you're writing an essay on yourself, as if you're writing a story of you. Or let's start like this. Tell me about you by writing a story in this way. Once upon a time, long, long ago. Start. Are you there? These children, because they live at the imagination level, they understand it better. But the similar, when the teenager is sitting with me, my first question is like open space, that I want to talk to you, but talk to me as if you are sitting with your best friend, and the way how you will tell to your best friend that what are you going through, what are your natural characteristic, and they identify with it because that's the age where they connect with them and they're sharing about their past, their present, their future to their best friend, or they identify in their non-fictional world which they are reading now. So those are many 50, 60 questions there. But what I'm trying to say that that's what the meaning, the open question changes. Similarly, yeah, when you do guided, once they stop and they don't know where to go further. See here, I'm not asking about different situations, different stages of their life, because they don't talk about those. So the best is directly enter into the subconscious, their fear, phobias, interest, hobbies, artwork, childhood, artwork. And some of them do speak about their illness in a very concomitant, in a beautiful way. Yeah. Then when you do active, of course, amongst them, whatever master key comes, you pick up that, but you ask in that particular way. Suppose one fear was very central part of their talking, then that master key would be asked from a fear aspect. If the dream was very in the center, then that would be asked. That tell me about this as if you're dreaming about this, or something like that. So this way, what happened? They identify with it better, and they because that's their language. They give you a proper answer. Of course, once you get sure of the master key, yeah, then the active is very similar. Any question here, anybody? Take your 2-3 minute, ask me till that time I go to the case. Is there any question, Preeti and Prajakta?
No question so far, sir.
Ask them, are they with me or how is it going for them?
I'm sure they are here. I'm sure they are here.
At least say, is it making sense or no?
Is it making sense, everybody?
No,
Maybe raise
I'm
your
asking.
hand. No, it's definitely making a lot of sense. Huh? It's definitely making a lot of sense.
Lovely. Perfect, Laura and sister. Yep. So, uh, so we pick up one case maybe. Okay. We can start with this case. Yeah.
Sure, sure.
Now, okay. So we have to do non-verbal also, no? So this is a 10-year-old, around 10-year-old boy. Yeah. Came with a chronic allergic rhinitis with total loss of smell, with on anti-allergic, and many times even because of the polyp formation and all those things, he had to be many times even put on the steroids. Yeah, is this course okay? As many of you have seen it. Okay. Since you're not writing anything, I go ahead. Yeah. Preeti, it's okay, right? This case?
Yes, absolutely, sir.
Perfect. Okay. So, see, first step, passive case taking. Yeah. And you see the question. Yeah. Tell about you. Yeah. As you will do when you are sitting with your best friend and sharing about you, your nature, your liking, all what naturally speaks about you. Don't worry, right or wrong. Yeah. I've just cut the video here, but we'll see all the follow-up videos. But the idea is we have just 2 hours so to save that time. And he choose. So this to start with liking. I like oranges, apple, drawing. I do not play in rain. And while talking about this, he looks up, his face is fixed like this, and then he will talk. He'll take a pause for a minute or two, and as we go further, more. Then he goes, I love chocolates, ice cream, waffles. I am weak. And then he says, I've got 2 times urine problem. Just make note of it. Yeah. And you, when you are going with me, when you are writing, write like Hahnemann said, on a fresh piece of paper, one below another, as it is, without interpretation, without analysis, without repertory language, as it is. Yeah, and check what is that coming up again and again. Clear? Okay. Let's see further. Yes, same question, and he's going further. I don't like fighting. I start crying many times when my sister hits me. Don't like fighting and I start crying. I don't like somebody shouting at me. I am weak. If somebody hits me, I start crying. I won't hit them back. I don't like half of my friends, they don't listen to teacher, and then we get shouted for their mischief. So you see, in this, whether sensitive to shouting or hate coming, I make note of it. further. Once he was not able to go further, you see, we started guided passive, guiding in the area of fear. And simple question, tell some of your fears which are real and imaginary, which are there since childhood till today without any reason. They're there with you. Yeah, many times I also say that as a child, I had many. So we all have. But then they suddenly, start sharing about them. So see what he puts here in the area fear. Once I was playing, I saw two coconut continuously fell down. Huh? And when I saw that, imagination came in his mind that what if I fracture my leg? And he shows his leg, this part, this part. Yeah. Now, do you know concomitant symptom? Of course, means that symptom which is there with pathology, but has no connection. Or there with even this situation, the coconut falling from the tree he saw, and he's showing me injury where in that part. Possible, either your head will get hurt, or most be in your front if you're standing like this or standing like this. Only if you're Michael Jackson and you go almost like this, then you will get hurt in that part. Otherwise, it's not possible. So I make note of it. Do I know what to do with it? No. Henneman's advice, 85, as it is. Done. Further, I got caught in the cage when I went to jungle for a picnic. I saw that some people are trying to kill me or shoot me with a gun. Sorry. By mistake, we go on to the dream part. Sorry. So the next part, I was playing cricket. Somebody took a stone and threw at me. Yeah, and I got hurt. And where he got hurt? Again in the same part of the leg. I make note of it. Then he said, I'm scared of getting lost. I had gone to waterfall and I fell down the water. Fear I could get lost and get hurt. Then the second area, guiding dreams. You see, tell me some of your dreams since childhood till today. Dreams which are different, not connected, dreams which are strange, doesn't make any sense, but stayed with you. Yeah. And see, he said, I was sleeping in the bed and I saw myself. I jumped out of the window because there was fire. I ran out and I got burnt. And my leg got fire and they were red. And again, he shows the same part. Yeah. I got caught in the cage where I went to jungle for a picnic. I saw that some people were trying to kill me or shoot me with a gun. Once I saw a dream that I had gone to Rajasthan, which is the northwest of India. I got lost in the town, never seen or heard before. So this lost is also coming. You just keep making, but check what is that which is in two or more than two areas coming again and again, and the one which is single but important, single PQRS. Make note of both. Then ask about illness. He said, I sneeze every day, I'm taking a lot of medicine, watering of the nose, occasional cough. In that part, the main chief complaint part, no characteristic. But he said again, remember right in the beginning, he said, I have got urine problem twice and I'm operated twice for it. And because of the injury on the head, I get confused a lot. Remember confusion? So I make a note of it. Now you see 4 areas. Do you see any master key running? If you want to answer, you need to be very fast, huh? Because we have just 1 hour to go. Okay. Anybody? What are the master key running and what are the other keys running? Anyway, so if you see the master key, I know I can't wait because of our time box.
Can I
Yes,
quickly just say what is coming up on
okay,
the
go
chat?
ahead. Beta.
This
Yes.
fear, fragile, getting hurt, injured, injury of the heel, feet, being lost, fear of getting hurt, injured.
Perfect. Fragile is our interpretation. Yeah, so this is what we do. We hear one sentence right in the beginning, we interpret into the rubric language, and then we see this is the thing. Like someone saying delicate. It's our interpretation. Those symptoms I call ATM, according to me. So all what you interpret in the bracket, right, according to me. Patient's word is not delicate. Yeah. So that is very important, that what I told you, and that's why Hahnemann knew we will do it. So right in the beginning aphorisms of the case taking, he write, as it is one after another on a fresh page. Very smart guy. He knew all of us will do it. So I agree with some of you that getting hurt was coming up again and again in open passive, in fear, in dreams. No? In fear, we saw that coconut, cricket ball, yeah, hurt. In open, the sensitivity of hurt, whether with other children or with sister, sensitivity to shouting. A long pause and he would stare. Yeah. Lot of imaginary thoughts and talk. Yeah. Then many other things came up, like lost in the Rajasthan. Got lost twice, he spoke about. Twice he spoke about urine problem. Then he spoke about leg, which is even the leg burnt in the same part, coconut in the same part, cricket ball on the same, or a stone on the same part. Making sense? So I know one thing, that hurt is important. And other things are coming up like this. Yeah. Let's see where it takes me. So I ask about, I become active. Look, see, this is just active. Yeah. And I ask, tell about this hurt. But you see how I'm asking, tell about the scary imagination of hurt. Why I use the word imagination on simple hurt? Because this child is living at the level of imagination. Every sentence, he looks up, thinks, and gives answers. And many of them come from his imaginations. You will know soon. Now see, when I ask about that, tell about this imagination of getting hurt, he says, in all my hurt, I imagine. Blood comes out of my body. I get pain, legs, fingers get cut, nail cutting out. I got hurt on the, I imagine that I got hurt on the knee, black color discoloration and blood coming out. I imagine leg would be black or brownish. Once I got a dream that there's a big blade and cut my finger and was bleeding. You see, all the imaginary thing is centered around injury, yes, but the blood he's adding. Once I fell down, I got bump on head. And then you look, did I told you I got urine operation twice? And the best part is when I speak to his mother, he said he never got lost in Rajasthan. The swimming pool, he never got confused and lost and injured. He never got any urine problem and no urine operation ever. Now you see, all this coming from his imagination. You may say false, but this is all his perception, delusion, whatever you want to call it. Is it making sense?
Yes, sir.
So now I got convinced that imagination, hurt, and they are all coming together, even this urine. So I said, okay, let's start active. Ask about this hurt in detail, because his meaning of hurt is his own. We may interpret in our own way. Let him tell me. So he said, there is a blade on my neck and bleeding, and the bleeding is so much that the lungs also get cut. See how he goes into all imagination. Bleeding so much that the lungs stop functioning. I see big line of the blood coming out from the lung. And the blood is fresh, bright red blood. It's very clear, 10-year-old, very clear. And this all never happened. Just imagination of hurt. And he goes to this extreme imagination, which is concomitant. Neither with it can happen with ball or a coconut, or, but that's his perception. Making sense? So once I understood this whole thing, I told him to, okay, I saw that this is what is coming up. I told him to wait outside, and I spoke to his parents with their kind of observation there, if I can get anything in mother's history during pregnancy like that. Yeah. And he sits outside and makes this drawing. Told him to make anything what comes in your mind. And this is what he makes. So there is mountains, and all mountains are on fire. Red color is fire. And then he makes himself with this leg burning. Remember this? Now, this is what I have. Go ahead. How will you solve this case and what you will give? And you need to be very fast because we have very limited time.
So can I ask you a question in the meanwhile?
Yes.
When you ask children to draw, do you ask them specific, like, is there an instruction you give that to doodle or not draw a thing or a scenery, generally how we would do for adults, for example? Is
No.
there
In a
anything
children
specific you
case,
ask?
in
Or
two
did you
ways
ask
of
him?
asking about a drawing area. One, in a guided passive where you are as a one area. Yeah, when you don't know, nothing coming in fear, or let's say something coming in dream. So you use one area as drawing. In that is draw whatever comes in your mind right now. Yeah. And keep asking this 2-3 times, 2-3 different papers, not just one drawing. And then check what is happening. If time permits, I'll do one case like that, short and fast. Maybe. Another way is that when you're listening in a first part of the case, you observe that a child body language is making something on the table, or in his talk, that I love art, I love drawing, I love painting come natural to me. Most of the time when I'm free, I'm just scribbling. Now you know that one of the area which he's in touch with is drawing. So now here the drawing can become the central part of the case taking. So in guided passive, you of course ask like that, draw whatever comes first. But then you can also say, draw your fears, draw your dreams, draw your imaginations, because he's more comfortable talking through drawings. So once you get the center is lost in alone space, let's say, so then the inactive, you say, draw this lost in an active space. That's a second way of using drawing. Is it making sense?
Totally.
Third way of using drawing is those children who are too much intellect, too much logical answer they are giving. To cut their logic, you take them to the drawing. There, the drawing should be spontaneous. Right now, what is coming up? Am I clear?
Yeah.
So like that. So drawing as one area of case taking, drawing as the central method of the case taking, yeah, where every question can be put into the drawing. And third, drawing as to cut their brain, logical brain. I hope it is. Yeah.
Yeah.
Any remedy coming up here?
So on the chat, we don't have the remedy, but there are some suggestions. So a remedy which covers bleeding disorders, linear cuts, hurt, and sensitivity in legs and feet. Dr. Rao
Let's
is
go
saying,
ahead. What is coming up in your mind?
yeah. There's Dr.
Ra-
Shweta. Can you hear me,
Random,
sir?
whatever you. Yeah. You go ahead.
Yeah.
Random, anything you want to put.
Yeah. Then Dr. Shweta is saying injury theme is going through and through in the case. So the remedy belongs to composite family. Dr.
Okay.
Aisha is saying there is a lot of sensitivity. So plant remedy.
Hmm.
Delusion, he's injured. Uh, One suggestion is pulsatilla. One suggestion is calendula.
Mhm.
So
Okay.
elapse, Dr. Sheetal is suggesting when you combine the
Pulsatilla,
orange and vein.
calendula. Okay. So this is what happens when we discuss case. Each one is discussing a case from our perspective. From my pulsatilla perspective, my calendula perspective, my arnica perspective, my injury perspective. So, there's a very famous, anyway. So the case when we discuss, it should be put into two part. Before you go to remedy, first put the center of the case. Then, whole center, then other characteristic also you put it in front of your eyes. Like this. Do you agree that the whole center of the case is getting hurt? Either cricket or coconut or bun leg or drawing or many other examples what he gave. We agree. So that we put. Then think what kind of this, the hurt with a ball or a coconut with a stone and all those things. The hurt with fresh, bright red, bleeding. Then hurt with extreme example of lung which was not involved at all in any of this example. Then hurt to a specific place, ankle or that part. And of course, one which doesn't make any sense of urine operation twice, where he had no urine problem and forget the operation. And still getting lost. Are you there with me? Put it, whether you know or you don't know, don't worry. What are we doing here is right now fitting into what we know. First put patient, whether you know, put all this thing. Now look at it and say, ask yourself, is any remedy coming up now? Anybody? Yeah. Go ahead, fastly put here. So naturally, when you look, of course, now you ask yourself, is this a case of repertory? Is this a case of theme to start with? Or a theme or the pathology? I'm not sure, but a lot of thematic language comes. So, okay, which are the group known for injury? So I say, okay, symphytum is known. From my materia first, arnica, bellisper, calendula. Let's say whole arnica group, which has 172 remedies. Then hypericum, symphytum, ledum, cocculus, all natrum sul, all what injury remedy runs in my mind. Yeah, perfect. Then I say, okay, then you start understanding, okay, ruta, rustox, you put more. Then I know symphytum has a specific kind of injury, old injury, injury to the nerves, nerves which are trapped in that old injury, like a phantom leg or a phantom hand syndrome, where you have abnormal sensation. Okay. Hypericum, acute injury with a sharp instrument, with a perforation and penetration in an area which is nerves are there, we call sential nerve, which is mentioned in Phatak Bori. In that area, like your earlobe or or nail bed, like that, where the nerves are too much. So I say, no, it's not kind of this sharp. Okay. Then you go to the ledum pal, exactly similar what we are talking in hypericum, but the pain travels to the different part. Then we read, okay, like that you keep your materia, whatever you know. Then you say, okay, let me look from a group point of view. Okay, there's an arnica group, which is whole composite or Asteraceae family, but that has in homeopathy 172 remedies, minimum in your boric Phatak. So now put yourself which has the injury as well as bleeding. Anybody in the center? Myristica sebifera, someone said, yeah? Myristica sebifera, again, a remedy belong to Nux moschata group. Yeah, but there the injury is different, like silica, where the particle has gone inside. Is it making sense? Yeah. So now start thinking, run your mind, injury with bleeding, fresh blood. Anything coming up? Yeah.
Millifolium is a suggestion that came up twice.
So the millifolium by Swetha and
Gunjita.
Gunjita. Okay. Perfect. So if you read the whole, so okay, millefolium, good. So I was reading which are the injury remedies which has this millefolium, definitely. Erigeron, which is bleeding remedy. If you know female bleed that, but passive bleeding, we know, and it is one of the anticoagulant drug in the modern medicine. They initially, now they don't need that, but Erigeron, Bellis perennis, which is also muscle and the blood part. Okay, which other? Like that. So when you read like this, so you start differentiating, and then of course you come to millefolium. Huh? So let's read, because two people have suggested millefolium. Read it. Now look what is written in millefolium. It acts on capillaries of the lungs. It's valuable remedy for profuse bright red fluid hemorrhage. Yes. Then you see ill effect of operation on the stones, biliary, renal, etc. Ill effect of fall from height and sprain. That's okay. Yeah. And it's bleeding remedy. And millefolium, if you check here, belong to the higher order asteroids, family Asteraceae, subfamily Asteroideae, and upper you can, and there I can't see there, but Anthemidae, which is your your Chamomilla sina group. Chamomilla sina, Anthemis, Artemisia vulgaris, all composite remedy belonging to that group. Time being forgiven. So the bleeding lung is coming, bleeding is there, and but where is the injury? Of course, you can say, see, it's mentioned in ailment from height and fall. But look, what was the earlier use of the millefolium? It is called wound wart. Earlier, it is used for military wounds. That's why it is called herba militaris, military herbs, soldiers' wound wart, like that. Before opium came in First World War, this was the remedy for injuries of the war. So yes, injuries, this, bleeding matching, this is matching. Perfect. And you saw that operation twice. What is not matching? Now go further. Look at it. What is the name of millefolium? Mille means 1,000. Folium means leaves. Yeah, that's why the lung, those leaves looks like capillaries of the lung. And you see the full name of millefolium, Achillea millefolium, Achillea. Achilles, no? That Achilles, your ankle. And see the mythology, that it was the Achilles came from the Greek hero Achilles, who used this herb to treat soldiers' wound during the war of Troy. And see the beautiful story, that to make Achilles strong, his mother hold him with that part of the Achilles like this, and put either him into the cold water, yeah, to make him strong. And we know this story, that part remained the weak, the ankle or the Achilles part. And that's how he died also. Is it making sense what I'm saying? Herring proved this remedy. Herring, or I think Herring, yeah. Of course, we don't go proving and all right now, because otherwise time will be too. Does it make sense? Now, if I look only from homeopathic perspective, I have only bleeding fresh, kidney and soreness and all those things. But if I look from a general point of alternative medicine, of history of millefolium, then I say, yes, it is a military herb used for military injuries. If I look from a thematic point of view, then I say, yes, it Asteraceae, whole group from Arnica, Bellisberg, Calendula, Echinacea to all speak about injury. Yeah. Now still I need to look from even the mythology point of view to understand ankle. Of course, injury to the ankle directly mention herring in the particular of the extremities. But that's not what we are trying, it has to be in a broader sense. This is what I meant by integrative holistic approach. If I only go with one book, Patak Borik, many will not fit into. If I go with one system, homeopathy, many will fit. The bleeding is fitting, injury is fitting. Yeah. Then the other system, then the injury becomes more better. Yeah. So I need to go multidimensional to check. This is what I was trying to tell you right in the beginning. Any question, anybody?
There's one question by Dr. Aarti. How do you understand the lost feeling in this case?
Very good, Aarti. Aarti, we need Aarti here. Then it can be solved. Aarti means delight. Very good question. Now Aarti is saying, sir, you spoke everything, but why are you avoiding? Why are you avoiding? Now, but where do I go? Where do I go? Okay. So Aarti here, see, only for Aarti, since she thought about it. The millefolium belong to tribe called Anthemidae of a subfamily Asteroideae. Anthemidae has remedy, chamomilla, senna, anthemis, tennesetum, millefolium, noble chamomilla, that is blue chamomilla, and many others. Santonine, which is senna's chemical. Like that, there are 39 to 40 remedies in this group. And when you study this group, you see chamomilla, irritable, and peevish, and all what we know of chamomilla senna. Abrotinum also belong to this group, similar. But in Artemisia vulgaris and in Absinthinum and Tennesetum, we see convulsion, epilepsy. Just a short, I'm making it for you right now. Whole study, I'm not talking right now. And all these 40 remedies speaks about affection of sensorium. That sensorium, the kind of where the sensory part of you, in just a layman language right now. This sensorium, when it gets affected, in chamomilla, senna, abrotinum, it comes in the form of irritability, and what we see, different depth of it. By the time you go to the tennesetum and Artemisia vulgaris, it goes to the level of convulsion. And when this gets affected, once the symptom which comes up in all of them running is confusion. Making sense? So injury, it's like, imagine those Hindi pictures. where the person fell down, gone into unconsciousness, he comes out and says, "मैं कहाँ हूँ?" In that confusion, what I'm trying to tell, that typical of Anthemidae group, because all of them affect CNS and sensorium. See, that's why I'm talking in one of my charity group where I every year take around 120 students, where I don't charge anything, but we all stay together and study. So this time I'm talking about this 172 remedies of composition, which has around 3 families, around 12 tribes, and around 220 plus remedies. Yeah, and then also the family of Manianthesi and Campanulaceae, which is your Lobelia group. Lobelia. And then you see 220, and we know just Arnica, Bellisper, and Calendula, and some more, 10. How each one has their own group and how each one has their center running. And that way we'll be able to use many of them. So how to find the master key of each remedy, and then each tribe, each subfamily, family, higher order, and then go all the way up to companionate class, going from the root up. Anyway, so did I answer your question? Who was that girl?
Dr. Aarti, yes.
Yes,
Yes,
Aarti?
she acknowledged it.
Yeah, Aarti, you have in your name only Aarti. Keep doing Aarti. Anybody else? No? So this, and I invite you, if some of you, I can't take all of you, but maybe few of you, we are doing it in indoor. So maybe 4 or 5, I can tell those who are doing to include you. Maybe what you can do, even if they want to come, which is on 24, 25, I think in August 10. Maybe Riddhi can send
Okay.
all of you detail.
Sure,
It's in
definitely.
Indore where
Sure.
Yamini, you know, right?
Yeah,
She'll
Yamini
be,
is a good
it's,
friend.
that's what they do. Yeah.
Sure,
But I
definitely.
can't take many, but just 4 or 5 is good.
Oh,
Okay.
good. Sure.
Perfect. So we go to follow up. Okay. Okay. First follow up, my colleague took Dr. Riddhi, who also took this case, first part of the case.
So we can't hear the child.
You will hear. It's my mistake. Now you will hear. So see, he comes first follow up, my because she took the first case. So look what he's speaking.
The dreams have stopped coming. No sneezes. All the fears have gone. Blood coming out of legs.
There's some issue, huh? So see, he starts with no dreams. All fears have gone. No sneezing. You see, start from where? The level where he is, that imagination level. Okay, hear him further.
The dreams have stopped coming. No sneezes. All the fears have gone. Blood coming out of legs. And neck getting scratched. Now they do not come. I am very confident about myself. Now I'm not getting lost because I go alone.
I don't get
anywhere.
lost anymore. Yeah, those blood coming from the neck and all those imaginations are Less by this time, all anti-allergic and still all had stopped. His sense of smell has come. Yeah, so that you will hear also. Second follow-up after 3 months.
Uh, I'm feeling better, healthy, and nice, and better than previous years.
Oh, 1 minute. He says I'm better, yeah, in all the aspect, and then he makes this drawing. So he's mentally better, physically better, emotionally better, illness-wise better. But look, when you random drawing, see what is he making? There is a one person, maybe him, another person, and look at this. A knife on the neck, sorry. A knife, oh, what happened? A knife on the neck. Is it making sense? A similar perception still inside. So the part is better, disease is better, dreams are better, fears are better, but when drawing wise is still there. Is it making sense? So we need to wait, check what's happening in the next follow-up. So overall,
This
at all
this
level, he
picture
was much
shows
better, and then he's just drawing something. Look what comes up.
mountains and not fire. In place of fire, there is grass. It became worst to best.
Yeah, worst to best. That there was another earlier, there was fire. You remember all this thing. But anybody, anything strange you're finding in this drawing? Anybody? Anybody? Anything strange? The
No
leg.
red color, the leg.
No. Look at the one leg.
Hmm.
Are you there?
Yeah.
So he's improved completely, but millefolium and Achilles millefolium, that permanent weakness inside which is there, he represent unknowingly so well. Is it making sense? So this
Yeah.
all drawings, beautifully how, see, if he's not made that drawing before this follow-up, I would say it's completely better. But the moment that comes up, say, so he's better at all level now. Even the drawings are shifting, but that fixed weakness is still there, which is okay. You acknowledge that weakness. Making sense? Anyway, any question? I go to the next. How much time I have, Preeti?
25 minutes.
Wow. Indian time or German time?
Something in between.
Something in between. Perfect. Now we go to non-verbal children. So, yeah, we have to go a little fast now. Non-verbal, yeah. Okay. So we go to non-verbal children, but then I have to short case. Okay, no problem. Naturally, after doing case taking like this, with children, especially with up to 16, and I started presenting, this is this book came up in 2008. So since 2006, I was presenting this kind of cases. All over, wherever I'm teaching, the question started coming, what you will do with non-verbal children. Naturally, in non-verbal children, the problem is they say observation. But observation is based on what? My observation is based on my knowledge, which is limited. If I know 5 remedies, I will observe through those 5 remedies only. We had teachers in college like that. No, they will observe through those fixed ones, which is their best knowledge what they have. So it is my observation is my bias. Then we say parents' observation, but parents' observation is their opinion. They will see, interpret, and they'll talk. Then they say mother's history during pregnancy. But someone asked me a question, what if it is an adopted child? So naturally, in such children, which is we call non-verbal children, children below 2, and all the special children, what we call uniquely able children, from autistic spectrum to Asperger to cerebral palsy to all what, all of them, we cannot talk to them the way we did with this child. So naturally, I was wondering that if one area I go into, chances of going wrong are high. So I needed many areas. And second, I needed to design questions in such a way, because the answer they will not give. Either I'll interpret my observation or parents will give, which is their interpretation. So I need to design questions in such a way that they don't go to their own story, but they actually give me the natural of the child. Are you there with me? And that was a big part for me. And that's where I divided. So we directly go to non-verbal. So non-verbal children case taking into 5 steps. My physician's observation, parents' observation, mother's history during pregnancy, physical examination of the child, and pattern or a system, which is running through and through in the child. Yeah, means not in the child. Sorry, my word. Don't go. A pattern, a verbal or a non-verbal, which is running in 2 or more than 2 of these areas. So I understood that. So my case taking is, 5 box like this, and I put all this. Now idea in each area, my focus is very clear that I want natural and spontaneous data of the child. What I mean by that not those data which is part of that family, that culture, that religion, that upbringing, or that way of living. You minus all those. It has to be natural and spontaneous of the child. So I said, my question should be appropriate. Yeah, I'll show you what I mean by that. So when I observe the child, I don't observe just in one area. I observe when the child is in alone space. Alone space means not occupied with parents or with homeopath or with the toys around. Alone when he's there, what is he doing? Then when he's interacting with homeopath, or when homeopath is trying to, or parents, or the assistant doctors, what is he doing? Or third, the toys or object in the room which which is there. So at least in 2 areas something comes up you are more sure of, and you are already minusing that gesture which is part of the family of friends or people, and because children mimic. So they'll first mimic his father or a mother or a grandfather or a teacher. So you minus that. It's the best way to watch. Next, parents' observation. Here again, aim is to get natural and spontaneous. You see what questions I ask. Sorry. The first one. What come to this child which is natural and spontaneous and not part of the teaching by you or a family or a culture? You see, keep repeating this question. What child does in alone space not guided by parents or people or others? So when he's in alone space, what he does? Because with father, he becomes like father. You've seen it, like we all, with father, we speak the language of the father. With mother, we become like her. With grandparents or teacher, we become like that. But when we are alone, aha, we show our state. No hidden, it's natural. So that's when he's alone and you're watching him, what he does. There you will get real PQRS. Then when his children are in touch with TV, mobile, storybooks, yeah, storytelling, and all in those rhymes, toys, in those areas, what is that which is natural, not part of your culture, your family, or you put into the child? That blue Baba will come, and if you don't eat, that blue Baba will come. But that you put that fear, minus it. What that which is natural. So when you repeat this question, they understand and then they give you answer better. And that saves you get natural data. Then the fourth part, every child gets some acute, right? Money every 3 to 6 months. At least virus is there every 3 to 6 months. So in different acute, if one PQRS is coming again and again, one general or one particular or one mental symptom or reaction, it will help you. Or one structure. Some children, every time they get sick, only the larynx get affected. So make note of that. Then observation made by therapists, especially special children. Therapists, they go to a lot of therapy. Check what they are talking about, which is they know what is disease symptom and what is common in all the children they are treating and what is specific to this child. They can observe it because they have an eye for it. So every time I tell parents to make note of that or ask your therapist, lot of thing comes up. So this question we all miss. Yeah, or now we have technology, so record 30 seconds to a 1 minute of that peculiar, which you see natural, spontaneous, not part of you family. Make note and send it to me so that I am sure it's not your interpretation. Yeah. Then when he interact with the people or friends inside or outside, what is the difference? Of course, change at physical level, yeah, particular level. Then mother's history during pregnancy, the part 3. The whole idea in mother's history during the questions what you ask specific. During those 9 months, the mother goes through a changed state. A state which is due to the baby inside and not of a mother. So what I need to focus on is on the change. My all questions should be designed on the change. Look at this. What changes do you notice in you physically, mentally, emotionally, which are generally not characteristic of you, which only came during 9 months of pregnancy or around pregnancy? And then, of course, change at the feeling, fear, interest, hobbies, dreams level. Ask each specific. Then change at the physical, general, and particular level. Also ask, sometimes mother's own state get also intensified. Mother said, I have a fear of dark, but during pregnancy it became 10 times. I have craving of olives, but during pregnancy it became 5 times more. So naturally that state which matches with the child will get intensified. So in pregnancy history, change and intensification. change at mental, physical, emotional, all level, and intensification at all level. This will give you of the child and not of the mother. And then examination finding, point number 4. Any symptom which came with chief complaint, what we call concomitant. Any characteristic of hair, eyes, ear, nose, teeth, and skin, which generally masters have told us to examine, we miss it. Open their mouth and check the tongue. You see, our master, Dr. Prakash Vakil, one of the homeopaths, have a book on the tongue type. Just open the mouth. If you get specific characteristic, it becomes specific symptom. You can't deny it. May the size, shape, color, coating, you can get. Examine their discharges, perspiration, urine, stool, saliva, and you may get characteristic. You read it in the book, undigested food, spinach-like. But once you examine, you will get them. Examine head to toe, because their vessels are still developing, nervous system still developing. You will see irregular distribution of heat and coldness. If you get that only one ear is cold, wow. Only perspiration on the tip of the nose, you know the remedy, and wow. So like that, this 4 areas for me become kind of, it takes my time. I minus all those autistic symptom and focus on these questions. And then check what are the symptoms which are only in one area and what are the symptoms which are in 2 or more than 2 areas. Those symptoms which are in 2 or more than 2 areas becomes my first step for searching the remedy. Okay. Now, since any question here? Now, since I have very limited time here, I do a very short case. Yeah. I don't do autistic or any, special that, because I'll need to go through in at least half an hour. I'll go. This is a case, but you will enjoy this case, I'm sure. A 2.5-year-old boy suffering from glioma, brain tumor, with metastasis in 7 parts of the body. I was treating since I teach every second year in either in France, Paris, or in the Switzerland. And these are the French-speaking people who attend, and most of them are modern medicine doctors. So the 3 pediatricians and 2 of them were pediatric surgeons, they were also attending. So they said, Dinesh, this is boy, and we cannot operate the original tumor because 7-8 metastasis, and he's not responding. The metastasis is not regressing. And if we remove the original tumor, for sure, he'll not survive. Till all this, at least 90% of them regress. And they said that, can you do something? I said, we sit together and see if something comes up. I'll be more, I suggest you. And that's where I took this case. I remember in my hotel room where these 2 pediatric surgeons were sitting, and we took this boy's case. So initially, again, there's 5 areas. So I was observing, though child was having a tube and all, but he was very social, interacting with me, trying to smile, and whatever I was doing, he would try to do. He was 2.5, so already, he was trying to do some movement, and he would tell his father to do some kind of dance or some kind of acting or some kind of wearing the mask, and father had brought all those with him. Yeah, so some role of some characters of what you call in the French opera, those, or the French kind of books, small children books, and he would try to do and try to laugh and all those. Then I was talking to mother, and then this 5 step of case taking. Yeah. So let's listen a little bit or just see it. Oh. Preeti, I'll just take 10 minutes. Don't worry, huh? I'll just fast forward. So those questions of observation, all yeah. So I'm not going into that part. So in observation, the child was smiling all the time and need the touch of the father and mother. And that was very important. Yes, he would only with them, he'll do all these things, what I told you. He was playing with colors, color books, loved dancing, singing music, and he was doing with his father, especially when father played the role of that some character. Yeah. And from their observation also, and my observation, no? In acute, when he gets lot of loose motions, and with that loose motion also his energy remained very high. Yeah, so that was another characteristic. Now when I spoke to parents' observation, parents said that he loves stories with different character, especially when the people are playing role play, mask. Start dancing with such stories, tries to act like them. Then she said, since childhood, there is a hiccup. Yeah. And she said, it's the same hiccup which I felt for 6 months, or the last 3 months of my pregnancy, which I would feel that he's having this. So since it was, she felt that time also, and now it's one of the characteristics. So I made note of it. Craving for chocolates and sweets. Yeah, another characteristics were perspiration profuse, aggravated at night, warm when on examination, on even their in this explanation, the warm soul and feet. When I examine, it was similar. Ears are cold. When I examine, yes, it was there. And on the chest, he's developed look like fungal warts on 4 or 5. Okay. And I was observing also the way he was dancing and those acting and was going on. Next. Sorry, here the mother's history and all got cut. Looks like it's a short version. Yeah, so mother's history during pregnancy. The one change is she loved watching opera, French opera, especially the classical ones. She being modern, she would love those old classical opera, especially those ones where they do the role play. Yeah, she loved traveling. She also had craving for sweets. And what she developed in last 4 months was warts on her chest. Yeah. And around the breast. What else was there? I think this is it. My observation, I told you, ears were cold. Yeah. And one more observation. I think this is it. Now, how will you treat this? Anybody? Any remedy coming up in your mind? Is it thematic or repertory? Anybody? Now, first, what we have here is 4 areas. What is that which is constant in 2 or more than 2 areas? both of them have warts on the chest. So I take note, and which disappear in mother after pregnancy. So I take that. The second one is both of them are role playing. So I make note of that. The third thing, my observation also hiccup is there. Parents' observation hiccup, and pregnancy also there was hiccup. So hiccup also. Then my observation and their observation, year cold, first period, the warm souls and this. Tell me, this is the totality of themes or repertory materia medica? What do you think? Naturally, here it is the totality of repertory. So that's what I exactly, I'm sure all of you will say that. Yeah. Oh, yeah. Yeah. So repertory, exactly. So I put that in the repertory like this, that warts on the breast or a chest in the same remedy, desire, love, like, ameliorates chocolate in a same remedy, similar way sweets in a same remedy where hiccups in babies or children in a same remedy with ear coldness. Yeah, kept adding one by one. The only remedy, if you only think what's on the chest, I'm sure you will get castor equi, thuja, nitric acid, calcarea, those remedies. 5 or 6 comes up. And they're specific. But when you look at the whole, the remedy which came up was only calcarea. Carbonicum. But the remedy which I gave was calcarea, phosphoricum 200. Now, phosphorus part, because of A, the very social child, early milestone. Yeah. Third, both of them like, the traveling, dancing, singing. Yeah. Mixing, role playing. So all those things, the phosphorus, which they express their identity and with all other symptoms. So I thought calcarea phos, and then when you read calcarea phos, anyway, everything is there in that right now, trust me, with rapid growth of body, precocity, travel, all those things. Let's see the follow-up. The first follow-up after 6 months.
We have not very good news, but we are doing quite well. He has still metastasis on the bones and inside the bones, but it's decreasing.
So except bone, all other 8 places it went away. And 7, when I do the first follow-up at 3 months, 7 places it went away, and that's where the boy became operable. Naturally, as a homeopath, I would feel it so much has improved, original will also go. And then I sat with the pediatrician, who were leading pediatrician of Paris, and not, they said, no, Dinesh, in area where it is, if slight growth, it can involve our basal ganglia and all those things, and he can be vegetative soon. So better we make sure that we originally remove. And once this is removed, the remaining one part now will go for sure. Okay. So time being, I'll directly go to the follow-up after maybe 3 years, just to save time. After 2 years.
Hi, how are you? I am fine, how are you?
Fine, thank you. Sorry, you can see he's fine.
What?
So you can
to bed,
Oh.
So you can see when that's energy, you can see where the phosphorus and this, but only when if they are around, he's secured by them, which we know calcarea, he'll do this. By this time, they had checked him 3 times with them, no metastasis, nothing. Yeah, we go to the 3.5 and save this time. And parents are just talking that in all level how he's better, and he's just playing around and just trying to take my attention, which phosphorus element do that. Now this is after 5 years or the 3 years of that.
How are you?
I'm fine.
That's it.
Thank you.
Welcome. What is he saying?
He said
That he said that we were still drinking coffee now.
Oh, I like coffee also. Can you share with me?
Il aime bien le café aussi.
Est-ce que tu partages avec lui?
Oui.
Said yes.
Okay, done. I love French coffee.
Attends,
He said it's the best.
How is he overall?
so he eats very well and almost everything. He has a lot of energy.
Okay. And it will be enough, like 3 years medicine.
Enough.
Okay.
And this is where I told them that stop homeopathy also. Once in a year, you just let me know what's happening. And since then also, it is 4 years now. Everything is okay. Perfect. So what I'm trying to tell, and then of course, whatever question you want to ask me, that in a children case, first rule is child-centric approach. Whatever is the approach, child-centric, not book-centric. Let child be the director, producer, storyteller, story writer of their own inner world. You, whatever ego you have, you are just a light man there, that he's doing his show, and you have to do you are not the director, you are just the light boy. The moment you can do that, they'll open up more. First. Second thing, in children case, do child-centric case taking. What I mean by that the questions you ask in a verbal children, you ask those questions which suits their age, like up to 7 to 10, ask questions which are, imaginary. I can give you hundreds of those questions which can be used in that age to start the case. Idea is to let them be in the central stage through where they are living their life. Then the teenager accordingly. And in a non-verbal children, as I told you, this 5-step. Whoever or whatever is the illness, if you do it properly, you will get PQRS, not only at a one level or one area, but PQRS at local, general, holistic, and in running in many areas. I think this is what I follow in nutshell. Of course, then lot is there, how to explore fear, dreams, all those and specific can be done later, but this is the basic. If you have any question, go ahead. Preeti, if you can let me know if there's any question.
Yeah, I think so. One question, I mean, there's a lot of appreciation for the case and, the whole process. I think a lot of people have mentioned that. There's one question by Bronwyn. She's asking, what was the repetition of calcarea first?
Yeah. So initially we started with few doses, like it was one dose, and every 7 days, and I told them to let me know in 21 days. That didn't do well much till we repeated it almost every day. Till when they examined him after 2.5 or 3 months, where the metastasis had gone down. And So till that time, it was given every day. And then again, it was brought back to once in 15 days till they were, he was recovering. This one metastasis were still there. And after that, once a month, one dose till I think 2 years or something. Because somehow the other, some small things were there. And after that, placebo for 2 years, we observed him for 1.5 or 2 years. We saw that with placebo also, he's doing very well. No thing, and even his acute level of acutes and all also improved. We stopped it. Any other question? Because I'm far now, so I can't see those questions.
Yeah, no.
That's why I'm asking you.
So, any other questions that are coming up? Maybe for for the benefit of the whole group, one or two questions that come to me is, um, uh, these list of questions which you said, in different age groups, especially with verbal, non-verbal, I believe will be in your book, right? So how can people get access to your books? Is it your website, or how do people get
So the
that?
direct, if I don't know if Riddhi is there or no, Riddhi can send a link
Hmm.
directly about the page where the books are there. Riddhi, if you are there, you can
Yes.
just put it. Oh, you're there, Beta. Okay.
Yes.
You can
Perfect.
put that link. Yeah.
Yeah,
So there is so they can have a look at it first. And yeah,
sure.
if some of you who are part of other song, it's there in the library. Some of you are in the part of some colleges. Mostly, yeah, in libraries
Sure.
they are there. Yeah.
Sure. And even the
This is the
international
one what she
participants can order the book from this link that Riddhi sharing.
exactly
Okay,
they can go.
perfect.
There is a section there, India and international. So they just click and easy for them to understand what is.
Perfect.
Yeah, yeah. And of course, with a translation also there, 7 translations. So they just
Oh,
click and they will go to that website.
perfect. And then I also wanted to check, sir, is there a way for people, if you have designed any special case record form that you use for children, and if there is a way for people to,
No,
access it?
I don't use the case form, but of course the whole model is there. This is like a basic 3 steps, and then in acute with children, and then what changes you do. Children with a psychiatric, and what changes you do. Children with a deep pathology, and what changes you make. Children
Hmm.
who are only in touch with one area, that's, let's say, art or fear, then how
Hmm.
to get whole from one area, how to design question, because that's just one area. How can you call it holistic? So then how you design questions so that from one area, actually you get the 7 areas, but whatever areas they are in touch with. So that those are, like we do it specific ones. And same with the non-verbals. So some shift, whether it is autistic or
Hmm.
Asperger.
Hmm.
So that way
Perfect.
it is very. And then how to take children to the remedy level, how to take children to the source level, how to treat children when right with the case taking itself, which is you make them aware. Then we have something called, which is I wanted to do but we didn't have time here, that with a non-verbal and a verbal children, we give a specific child-centric diary. And that diary is, let's say, verbal children. So that diary is like, so in a case taking, let's say they only give me location, sensation, modality, concomitant, let's say one-sided, one area. So this diary guides them. There are specific sections there, so they can make note of different things in a specific way. Then there is a next section is guided method. So based on that child, some specific methods are given so that PQRS come on the surface in the next follow-up. So this is during follow-up. Then that same diary continues. Once they start improving, then our patient-centric advices, child-centric counseling based on what whole coming up comes up from that diary. That why I say this child should be taught in this way, should have this artwork, this sports, and this way he will do very well based on what comes up as a whole. So, and same diary is there for non-verbal children, because in autistic child, in a first interview, all cases will not give you the whole. So you need to prepare parents how to give. Otherwise, parent will bore you. Every time they come, they sit for half an hour, 28 minutes, they'll talk about autistic symptom where there is no PQRs. So you need to train them how to talk to us, what to give it to us. And then they become almost like a homeopath at the home. So that is what we call non-verbal children diary. But we didn't have time here, so I had to actually explain, otherwise half knowledge would be. So these two diaries, any of you interested, write to Dr. Riddhi, and those who are practitioners, she will send it to you. It may help you in your practice. If you don't understand, she will guide you what it is about.
That
So
will be wonderful.
it's my at least short version. I'll send it to you, the PDF version, and then you can make it in your own way.
That will be wonderful and very helpful.
Perfect.
So
Riddhi, you can write them which email to send, so that.
Yes.
yeah.
Yeah.
And maybe Riddhi, you can send it to us and we can, because a lot of people are not able to join us live, sir. A lot of
So
them are going
what
to
I
see the
will do is
recording. So
at
yeah.
least those who were live. So because they took pain to come here. So this 64, if you send email, I'll send them all what I taught, notes as it is, as a PDF, but only with a password so that they can download it.
Sure, sir. That will be
Riddhi, if
great.
it's possible,
And
send it to them.
Yes.
thank you so much, sir. That is very kind and generous. And a lot of comments on the chat are also that this was just a taster. I mean, I think people are craving for more. And if you will be willing, sir, we'll be very, very grateful if you can come back and teach us a little more in depth without any limitation of time, etc. We'll be more than happy to learn from you, sir. We'll be very, very grateful. Uh,
Definitely will work out, because the only thing is because of my
yeah,
so
your
much
schedule.
travel.
I'm sure. I'm sure, sir.
I know you
So,
were
anyways,
asking me for last 2 years, right? For something Riddhi
yes,
told me. Yeah.
yes.
Sorry, but it is actually because of this. July, August is the month I'm in India, and I make sure that I do all this.
Yeah, thank you so much,
My
sir, for
pleasure.
coming. And I think it was an excellent session. My personal take back, and just as a reflection for everybody, is in the non-verbal section. Those 5 points, and how to kind of pick up more than two areas, and use that as your primary totality. Excellent learning, sir. Definitely will take back. And in the first case, how to, not just in the primary initial consultation, how you use that drawing even in follow-ups to see how well the child is doing with the remedy. I think those were, for me personally, the biggest highlights. But once again, very, very grateful for your time and your teachings. And thank
My
you to
pleasure,
you and
dear,
your
and
whole team.
my pleasure, dear. And you keep doing this way and keep reaching out and keep spreading this depth.
Thank you so much, sir.
Perfect.
All
All the
right.
best. Yeah. Take care, everyone, and bye bye.
Bye.
Thank
Have a
you.
good rest of your day and week. Bye,
Thank you,
everybody.
dear, and all
Thank
the best.
you.
Yeah.